The average Joe or the average person in the street could be an individual that has received services, and it doesn't make individuals less than. And on the contrary, I think it builds resilience and ability to care for others. And it's okay to struggle. We all, carry, weight, and life is not easy. If you have breath in your body, you're struggling with something. So we just don't have to struggle alone. Welcome. My name is Dr. Texidor Maldonado, and I'm from Caguas, Puerto Rico. And I got to start here because I've been a part of this community for since 1989. So I know, don't try to add the years. To our community partners, elected officials, neighbors, and friends, thank you for being here. Your presence today is a testament to what we could accomplish together. When we come together with a shared commitment of health and healing. When we provide access, with compassionate access to individuals, it provides them ability to heal. And this medical center expands that access. And it's not only a new facility, but a doorway for recovery for individuals in our community.
Well, I think the most important part about this building is that we built this building specifically designed to meet the needs of our clients. So it wasn't just a building that we bought and we tried to make it work the best that we could. It's a building that we built specifically for this purpose, and I think that really is going to make a difference. Well, I think the key that we focused on here, as you've seen this building and as people see this building, is comfort. It's comfort and safety and all those things that everybody looks for to feel, really comfortable and cared for. That's what's going to really allow them to start making some changes, is when they feel comfortable. Right, so the food is amazing. We have amazing food. The atmosphere of this building is, it's beautiful. It's what they deserve. It's what our clients deserve, we feel.
When Bridgeway was first dreamt of, prior to even Tim coming on board, it was an individual in our community saw folks intoxicated in the street, being left to the elements and not nowhere to sober up. So we see that, unfortunately, in our streets today. So the sobering offers an opportunity for individuals who come in contact with law enforcement or who are intoxicated, a place to sober up safely and with medical care observing, so preventing potential overdoses and things like that, or really minimizing or decreasing the access to hospital services. So if somebody's intoxicated and the emergency paramedics come into contact or they respond to a call, rather than taking them to the hospital, if they're intoxicated, then they could probably bring them here to receive care. Once the person is in a ability to make the choice, then they could go, if they choose, to detox, to our medically managed withdrawal. And if they decide to go to outpatient services, then they could really go through our continuum of care, receiving primary care and other services by just walking through our doors.
What makes it really significant for Bridgeway and for our community is that this is the missing piece to the whole recovery system, right? So a lot of times, people will come in and they're, Maybe they're intoxicated. Maybe they want sobering. Maybe they want medically managed withdrawal. Maybe they want to get on into residential and get started. And maybe they don't want any of that. Maybe they don't know what they want yet. So this gives the opportunity for somebody to just have some time to sober up comfortably in a safe place, and hopefully, have some time to think about that. And the hope would be that, once that sobering process is done, that they will decide to go ahead and go into withdrawal management and let us help them find some other ways into treatment. So I think it's that missing piece. This is the missing piece for us. And people always come in with their own plan of what they want. We don't give people, we don't say this is what you need to do, this is where you need to go. We work with whatever plan they want. So if they want to just, say for example, they wanted to just sober up for the night and go back to whatever they were doing before, that's fine. If they wanted to go on and just have some withdrawal management services, that's certainly an option. But if they wanted to continue, however they want to continue in recovery, then we're there to support whatever plan it is that they're looking for. What we do know for sure is that, the need for sobering, the need for all treatment services is a community issue. So our plan is to really lean on our community and trust that they'll be there to support this need. We don't have an exact formula. We're trying to keep the cost obviously as reasonable as possible, but our real goal will be to try to get some community support. And so we'd like to come up with a way that the community members, individual businesses, individual community members, places that use services like the City of Salem, City of Kaiser, Sheriff's Office, Hospital. We'd like to invite all those partners to do some sponsoring and get some sponsors for the beds so that they're available for whoever's ready to need them.
I look forward to the continued collaboration and partnerships that we are having with our, behavioral health resource network partners, Marion County, our fire department, and our sheriff's office, the police department across the street, UGM. So really is the community coming together to ensure that folks that are ready for care receive the care they need, and people know where we're located, how to access our services, and they could get the help that they need, that they want.
The other additional really benefit for sobering is it keeps people from going to jail when they don't need to go to jail. It gives local law enforcement some place to bring someone so that they can just sober up. Some places have diversion programs to where if people, will come to sobering and just get sobering up, they may not get a citation. If we can divert anything from our already busy, criminal justice, programs, then that's a good thing, right? Because that would keep people out of jail, keep people out of court, keep people out of the hospitals, and all that stuff just really seems to compound. Once that system kind of starts rolling, it just kind of keeps compounding, and pretty soon you have a spot that's really, really difficult to get out of. This is a community issue. These people are part of our community. They're our neighbors, our family, our friends. They are part of our community, and so it's really a community issue. It's not their issue or Bridgeway's issue, or it's a community issue.
What we want to do is put compassion to work and support those individuals that are struggling without making them feel less than or punish, rather than we rather support. And if they're dealing with the justice system, then we collaborate with our community partners to help them meet that accountability from our legal system, our justice involved folks, but we provide the compassion piece and be the hands and feet that help them walk through those channels.
It is a process. It is not, just drop somebody off at withdrawal services and then when they get out they're better, or take somebody to residential and when they're done, they're all better. And sometimes it happens that way. We wish it would happen that way all the time, but most times it is a process. The recovery is a process, and sometimes a long-term process. And so it's patience, and the willingness to, come back. We have people that come back several times, and we keep trying, we keep treating treating them. We keep developing a new plan. You know, if the last one didn't work, let's try something else. So we just keep trying, and I think it's patience. You know, patience and love and understanding, compassion, all those things.
Our staff, not to tell other people's business, but our staff is comprised of individuals who have found themselves on the other side of those looks and that stigma, and through that compassion they received within Bridgeway, have decided to rededicate their passion and become servers of our community. So, and obviously that's not all our staff, but a large number are individuals that know what hurt feels like and what struggle feels like, and they have the passion to help those that are still struggling. Many, many years ago, Tim Murphy had a vision of bringing integrated care to our community, and with the help of many community members with different expertise, he gathered this team and slowly began building what Bridgeway Community Health is today. He wanted a place where individuals could come get care they needed, whether it be medical services, dental services, help for mental health, problem gambling, and substance use disorder, without the stigma of dealing with behavioral health issues. So today, with the ribbon cutting, we're really opening a pathway that leads to health, dignity, and hope. So thank you. And with that, I want to welcome our founder, former CEO Emeritus, and many other titles, Tim Murphy. Let's give him a round of applause.
Well, wow. This is amazing. This has been a long time coming this day, and I'm really pleased that you're all here to share this moment with us.
Ribbon cutting does not just symbolize one moment in time where we cut and we forget. Yes, hopefully this photo's up on the wall and we reflect back on this time. But the bigger thing is not who is looking at you right now, it's who's standing behind you. These are people that have committed to build this project and committed to a healthier Salem. That is something that has nothing to do with politics. That has with bringing people together and creating a healthy community. So today we're going to I'm going to ask you to join me in the fun countdown. And we'll go 3, 2, 1, and we'll cut that scissor and we will celebrate this moment, but know that this is just but one moment, and the future of this building is where the real special magic will occur.
What I'm proud to say today is I kept my commitment to the staff to get more space. I kept my promise to Jerry and Jason Myers that we would open sobering, and today it's a dream fulfilled. So thank you for being here.
Ladies and gentlemen, if you would join me, 3, 2, 1. Congratulations. Wonderful.
Learn more about Bridgeway Medical Center and all of Bridgeway Community Health Services at bridgewayrecovery.com. InSight OnSite is sponsored by Golden Ruleism Ambassadors Craig and Sherry Klein. Thank you for joining us on InSight OnSite. I'm Wendy Brokaw.